Nutrition 101, what you really need to know about feeding your baby. So let's get right to it. The number one question moms always have is, and even second and third time, and I can tell you that as a second time mom, I'm like, this is one of the most pressing questions there is. So once you have your baby, our lives revolve around feeding. Is my baby getting enough? How do I know they're growing? What's the best way to feed them? Dr. Steph Lee is a general pediatrician in Pennsylvania and specializes in preventive medicine. She is also a spokesperson for the American Academy of Pediatrics and is here to talk to us about baby nutrition and feeding. All right, I know this is going to be a hot topic, so take it away, Dr. Lee.
Awesome. Thank you so much for the introduction. Super excited. We always get, now we've talked a lot about how to take care of yourself, how to prepare, and then, the birth process. And then now you're at the moment, now you have a baby in your hands, right? What do we do next? I do have slides, so I'll share this here. All right. And so like mentioned, as Mina mentioned, I am a pediatrician in Pennsylvania. Let's go see here. All right. So first of all, the most common question really is, how do I know they're actually hungry, right? And because the three things that a baby does in the beginning really is just poop, cry, sleep, pee, right? So one of the things really you have to watch out for are listed here, rooting signs. When they're moving their jaw or mouth, they're looking for the breast if you're breastfeeding. Or even if you're not breastfeeding, they'll still move their mouths that way, licking their lips, sticking their tongue out. A lot of times, and we'll go through this in the next slide, you have to watch out for these signs before they cry, because a lot of times the crying part means they're already hungry and they've already started feeling it's a later sign, right? So it can be a little bit harder if you're trying to establish breastfeeding in the beginning. It can be harder to get them to settle down and eat. And that can be a very common problem with, in the beginning with latching. If they're already struggling, now they're super hungry, it's difficult. So it's a good thing to try and figure some of these signs first in the beginning, so you can try and feed them before they get to that late stage. Sometimes fussiness, sucking on everything around. A lot of times, it may be in the beginning, they're trying to communicate, right? And so I always say, you can check first their diapers, make sure, do they need to be changed, right? Are they just looking for comfort? And a lot of times, of course, the hunger signs, then you can feed and see if that calms them down as well. One of the things I always tell my parents who are in my clinic is to check out healthychildren.org. So that's the parenting website for the American Academy of Pediatrics. So most of those are all written by pediatricians, or they're approved by the Pediatric National Society. So there's a lot of good information and really broken down to help on different feeding, but also, for toddler and teens as well. So not just for infants. Another common question is, how much do they actually need, right? So you're trying to pay attention to these hunger signs, but you're trying to also predict beforehand, before they're starting to get really hungry and crying, right? And getting upset. So in general, for most newborns, you're feeding about every 2 to 3 hours, or 8 to 12 times every 24 hours. So I kind of broke it down between different weeks and really up to the 2-week mark, because after that, you should be pretty well established, and it's about the same until about a month or so. In the first 1 to 2 days, babies may be feeding every 1 to 2 hours if you're breastfeeding. If you're bottle feeding, 1/2 to 1 ounce per feed. It would be the same if you were, say, pumping or doing formula. Then the first week of life, so after day 3 and on, they may still be feeding 1 to 2 hours, but they may be spending more time at the breast, 10 to 15 minutes on each side, or may increase, if you're again using bottles, about 1 to 2 ounces. On the second week, they may increase to about 2 to 3 hours, or 2 to 3 ounces per feed. And this is when they should have caught up to their birth weight. So generally for pediatricians, we do see babies a few days after you get the moms leave the hospital. And then usually at about the, 1 week to 2 week mark, kind of depending on, if you had to have a longer stay in the hospital or not. And that's because by the second week, they should be back up to birth weights. I think the lactation consultant had mentioned earlier, you do lose about 10% of birth weight as a baby. And that's usually because there's a lot of extra fluid, that they were taking in when they weren't trying to actually feed through their mouth. So there's an expected loss, but it's important to see your pediatrician in that first week to 2 weeks, because the amount of loss, if it's too fast, then that can definitely be a problem. They want to keep up with that. That may be a time if you were breastfeeding, for instance, and for some reason your supply is not coming in, or its latch is difficult and you need to supplement, then that would be something to talk about with the pediatrician. And they would track that with weight. And we do recommend breastfeeding, if possible, for the first 6 months. I know this question had come up earlier as well. We have a lot of overlap with lactation, so it's one of our people that we talk to a lot, especially as pediatricians. The mom can take vitamin D, or the baby can take vitamin D. And a lot of times your insurance will cover that, or at least be able to, if you have a FSA or HSA, a savings account, they can reimburse you for that. So definitely always ask your pediatrician if you are breastfeeding and if they can prescribe the vitamin D for the baby, and that's totally fine. One of the things too, I always get, should I wake the baby up to eat in the middle of the night, right? If you take a look back at the hours we were talking about, it's every, 1 to 2 to 2 to 3 hours in the first 2 weeks. And it is very important I always say if they're sleeping past the 3-hour mark, you should be waking them up, at least in the first 2 weeks, once you get up past your birth weight. Because in the beginning, if depending on if you're breastfeeding or formula feeding, or if they're having trouble latching, et cetera, then they may be not waking up enough, and that can be a concerning sign. So in the beginning, you definitely want to make sure that they're feeding at least every 2 to 3 hours, especially in the first 2 weeks. Some of these things on the right I mentioned here. So we didn't touch on this too much, but if you for some reason have a baby who's preterm, so that's before 37 weeks, they do track their weight gain a little bit differently than if you're preterm and lower birth weight than normal. They do track their weight a little bit differently, but in general, if you have a preterm baby who is heavier weight, or a term baby who from anywhere from 0 to 3 months, you should be gaining about 25 to 30 grams a day. And I know we go by metric here, but it's because there's about 28 grams in an ounce. And so it's hard to use ounces, especially in the medical world for this, because you want to be very specific about how much they're gaining, especially in the first 2 weeks to 3 months. So they usually track that at the pediatrician's office, of course. But it can be a good idea if you think, okay, on a ballpark, if they're gaining about an ounce a day, then you should be generally okay. Because I know a lot of parents, they get worried in the beginning too. So you want to you can of course try to get a baby scale and track it yourself if you like, but still in the first 2 weeks, it's harder to do because you're trying to be very specific with how much they're gaining. Sometimes, like we said, you do need formula, and that's completely okay, right? And you gave birth to another human being. There's every expectation can definitely go out the window, right? Like we said, it's birth intention, instead of birth plans, and birth intentions, and also the feeding, right? It's feeding intentions, right? You try to do as best as you can with breastfeeding, but sometimes that's not for everybody. And so there's a lot of different products out there. I've highlighted some just to kind of give you some categories to try and understand, if you have to go down this route, what you may need to talk to your pediatrician about. So sometimes, we talked about already, if you need formula for supplementation because your baby's still trying to learn how to breastfeed, or having trouble latching or having trouble gaining weight initially, then they may need to use any one of there's a lot of different products that can be done for that. the specific ones that can be very confusing is if you're trying to use formula for different reasons. For instance, if your baby has a lot of fussiness, gas, or colic, right? You can do lactose-free or sometimes broken down lactose, because some people think that it may be a problem with the digesting lactose in the beginning with some formulas. So there are certain different products and that you can, usually that's like the soothe or gentle or sensitive. Those are some kind of terms that people use on their formulas. Also, sometimes you can use soy-based as well. So soy-based formulas, especially if, a parent is vegan or they're trying to decide they don't want to use animal products, there are a lot of soy-based formulas that can be helpful that you can go to as well if breastfeeding is then not an option. Sometimes a very common problem is, spit up and reflux. I always say every baby will spit up, and that's why all the bibs are out there, right? But it's to what degree does it really bother them in their throat, right? To what degree is it affecting their weight gain? And sometimes, if that is a problem, then you may need to switch to a rice starch or oat cereal mix into breast milk or formula. There are certain products that already have the rice starch mixed in. And so that can be helpful if that's something that parents want to do instead of trying to mix in the oat cereals and rice cereals themselves, which you can also do with regular formula or breast milk. Sometimes if you're really having trouble, there's with weight gain or with constipation, then you can switch to formulas that are hydrolyzed proteins, both partially or extensively hydrolyzed. And these definitely are, in discussion with your pediatrician because they can be used for different reasons. One of the most common might be milk protein intolerance. So usually that means for some reason, a baby is just not digesting the milk protein either in breast milk or in formula correctly, and they're really having trouble with their digestive system and having issues with gasiness, sometimes constipations I mentioned. So two commonly partially hydrolyzed protein products are Nutramigen and Alimentum. That can definitely help. And that doesn't always mean you have to be on them forever, because they're certainly more expensive as well. But it can be for a certain period of time to kind of wait to calm down that inflammation in the stomach. And then you can discuss whether you want to switch back to another formula after a few months. The other thing too is with milk protein intolerance, that doesn't mean that, they're forever having an allergy to milk, right? A lot of times after 12 months, when you can introduce cow's milk, they can always try that at that time. Then the last one is the extensively hydrolyzed protein formulas. So those are where they're completely broken down. You can see it says amino acid based powders. And so this is for, if you're really having severe losing weight and need the last option where there's really no proteins that are together, they're all amino acid based and broken down already. So the idea is that it's maybe easier to digest. All right, and since I was, looking at the chat earlier, I saw a question about storage and breast milk as well. I just thought to add it in here. This is from the CDC. You can Google CDC storage breast milk, and this will come up, or the link there. But it's definitely something I think that is important because a lot of times, you want to know that it's lasting enough. So up to 4 hours for freshly expressed or pumped breast milk can be on the room temperature. And then refrigerator can be up to 4 days, and then freezers for sure, it can last up to 6 months or more. And then definitely you can use leftover from a feeding up until about 2 hours or so, as you can see at the bottom. Sometimes, babies, they're cluster feeding or which they can do still on the bottle, or they're not, finishing the full feed, however much, if you pumped however many ounces you have, you can always use that leftover again within a few hours or so. All right, so that's all that I've got here. I'm sure there's maybe some more questions or anything. happy to take any.
Well, there are so many questions that I know people have. I mean, one of them is, how do you know that your child is having like a protein or milk allergy to the formula that you're giving them?
Yeah, so sometimes that allergy, it can be difficult to diagnose. There are certain symptoms such as constipation, increased fussiness, sometimes blood in the diaper. That's the most telltale sign, and that's because there's a lot of inflammation that's happening in the gut, and so because of that, they think that it can cause some blood to leak out from the tissue in the gut. And it's definitely an important thing to talk to your pediatrician about, because there's also, fussiness just from gas, right? So generally it's, you try to do some, gas drops, things like that first, what we call reflux precautions. And then if those don't work, then it's definitely time to switch and try a different type of formula.
Cool. I mean, I know one of the questions that I have is, when I had my son, he was 7.5 pounds. At his 2-month appointment, he was 13 pounds. So he like went way up on the chart. And then after that, he became more mobile earlier. And so he slipped way down the chart. And so it's been this really stressful time for me to kind of figure out, like, I know every baby has their own trajectory, but they're all supposed to keep moving up the trajectory. What happens if they go up and down like that? And when should I become worried?
Yeah, so that's definitely a good question, because as pediatricians, we always track their weight on the growth percentiles, which are both CDC and WHO, the World Health Organization, projected growth percentiles for every baby at from 0 to 2 years, and then 2 years and on. So usually if they're within 1 or 2 percentiles, you're still, dropping either up or low. It's usually okay. We think, maybe there's some measurement error. Maybe it's just, depending on how old they are, if they're being a little picky, if they're eating solid foods already or whatnot, or if you changed a formula, you expect maybe a little bit of adjustment. If it's if it's changed 2 percentiles or more, then there's definitely a deeper evaluation that needs to be done, because is it they're not digesting it enough? Sometimes you do find that with milk protein allergy, that they may not be absorbing all the nutrition enough because there's so much inflammation, it's just kind of coming out, right? So that would be where it starts to be a little bit more concerning.
Got it. I think people always want to know, is it okay to put baby cereal into my baby's bottle so that they'll sleep longer at night? And does that really work?
Yeah. Yeah. Well, we definitely get this question a lot, especially sometimes grandparents, I think, because this is an older generational idea that that would help soothe, crying and sleep, right? It does work, but also because you're basically making them feel fuller, but you're also adding calories. So we do say not to add rice cereal or any sort of cereal unless they're having issues with reflux, because that is a solution, as I mentioned, with reflux or excessive spit up. But I would let your pediatrician know and chat about that, because a lot of times, again, you don't want to give too much weight gain, because you can, obviously lead to more problems and increased risk of obesity for future in life if they start out having too much weight gain.
Okay, cool. And then when can we start solids? Is that something that, remember rule of thumb was 6 months, but can we start sooner? Can we go later?
Yeah. So the American Academy of Pediatrics does recommend 6 months as a general rule, because that's when babies start sitting up more. They have a lot more neck control. They can usually sit up without too much support, maybe like a little hand or something on the back. And that's to make sure that they, by that time, practically all babies will have developed swallow for solid foods, and also better neck control. So they're not gagging as much on anything else that's thicker than, breast milk or formula. Sometimes with some, when I see parents, usually we see them at 2, 4, and 6 months. Sometimes at the 4-month mark, if I feel like their development is going amazingly, they're much farther developed in their gross motor control than the typical baby, then I may say, okay, maybe at about 5 months, you can start doing some tastes, just a couple like teaspoons or something, just so they get used to the textures. And then you start, real solid foods around 6 months. But there's some flexibility, but in general, mostly it's 6 months, because it's hard to predict, right?
No, it is. And I was also wondering, like, a lot of people, with my first son, I started with purees, and with my second, I did the baby-led weaning. Is there
Mhm.
one that's better than the other? And how do you know which one's right for your baby?
Yeah, baby-led weaning has really become a big thing, I think, in the recent years. And I mean, I'm all for it. I think it's the only thing that parents need to be aware of is, you're essentially still doing the same thing. You're offering them foods that are developmentally appropriate, which at 6 months is still pureed soft type foods, right? It may just not be the jar food. It may be mashed potatoes or, sweet potatoes that you've mashed and that kind of thing. Or like porridge, cereals, that kind of thing. So either is totally fine. I think it's up to, the parents to decide, which direction they want to go. Sometimes baby-led weaning, I think, can be a little bit more messy because you're allowing the child to feel and touch and try to put things in their own mouths. And so developmentally that, in the beginning, they can be a little bit messier. So if parents are ready for that, then they can certainly do that.
One of the questions that just came up is, what are some of the best, I would say, first foods to try?
Yeah. That there used to be some idea, that it should be fruits versus vegetables versus meats and that kind of thing, right? But I think really, I would say like oatmeals, yogurts are good, especially if you're getting used to moving away from getting more of that calcium and stuff in with the yogurts, and something if you're pureed jar food, fruits and vegetables, or if you're doing purees yourself, like sweet potatoes, mashed potatoes, something like that. Yeah.
I
One
love
thing to
that.
note, I was going to say one thing to note is that they used to say like for allergen type foods like peanuts, shellfish, eggs, um, to wait until about 1 year later. But recent research actually says that the earlier you introduce it, the better, because you can decrease the risk of getting an allergy to foods later. So generally I say first try, fruits, vegetables, meats, that kind of thing. The first, month or so. And then after that, after they've gotten used to that, you can start trying to introduce these allergen type foods. So instead of peanuts, of course, because that's a choking hazard, right? You would do like peanut butter or something that has peanut powder products, that kind of thing, just to expose them to that. And of course, watch very carefully. If there's any family history of allergy, then you certainly should, talk to your pediatrician first, and maybe you do need to see an allergist or something beforehand. But generally, I would do those non-allergen type foods first, and then about a month or so, you can start trying the allergen foods.
How do you know if your baby's having an allergy to the food?
Yeah, a lot of times it can be like rash or something that comes out, or some sort of like worst case, maybe some vomiting, that kind of thing. Trouble breathing, of course, anaphylaxis symptoms. You would definitely stop. Give some Benadryl and then call your pediatrician. But if you usually give like a small teaspoon or so, you shouldn't have any too severe reactions. They did find that in some studies that for allergies, if you're for allergen type foods, if you're giving eggs or something first, right, put it straight into the mouth. Don't, have them rub it over their face and stuff, because the skin can still be very sensitive, and you may think they have an allergy because they're rubbing the eggs on their skin.
Okay.
And so it's actually better to just feed first, and then instead of having them play with it, because normally for other things, you may have them play with them first just to get a feel.
That's such good advice. One of the things that I know as a new mom that stresses me out is, if you choose to go get your child vaccinated, that is like honestly one of the most stressful times. I feel myself getting very anxious. Do you have any tips for people about, being a mom that's anxious, and then two, when your baby is crying afterwards, how to soothe them, or any best practices?
Yeah. So generally the first, you get a hepatitis B vaccine right at birth. Sometimes moms don't even know because at that time they try to get that in right away. And, depending on how your birth process was, you might be out of it for a little bit. But generally the hepatitis B vaccine is the first one at birth, because that's the one that is most severe if it's transmitted. So they do it right away. The next set actually isn't until 2 months. So you get them usually at 2, 4, and 6. Then you get a bit of a break. Usually at the 2-month mark, especially if it's a first time mom, it can be very difficult to see because you don't want your child to be crying, right? But they're super important to get. So I always say, you can give Tylenol afterward if you need to for fussiness, a little bit of fever that can be expected. You can always ice the area on their, if their thighs, if it gets a little bit red, that's okay too. And then just lots of cuddles and swaddles.
I love that. What's your number one piece of advice for new parents out there?
Yeah, I'd say, and I think there's the theme throughout this event has just been, give yourself grace and be kind to yourself because, you plan as much as you can, but at the end of the day, it can be unexpected. Things may come up and it may not be exactly what you wanted, and it may be exactly what you wanted, and that's okay either way. I think it's important to remember to be as flexible as possible because you're adjusting to a new life, and that's super exciting and important, and also can be very stressful. So just making sure to take care of yourself too, and you and your partner both, because a lot of times we always take it on ourselves as moms that this, I went through all this and I had to do all this, right? And it affects the dads and or other moms, depending on what your family situation's like. It can affect other people too. So just making sure everybody's kind of taken care of and gotten the support that they need.
Perfect. I know one of the questions I had when I was looking to get a pediatrician, because you need one to come to the hospital after you give birth. How do you find a pediatrician? Do you interview them? Do you pre-meet them? What is the process of getting a pediatrician for your soon to be born baby?
Yeah. So a lot of times it can be, word of mouth, just asking around, your friends in the area, recommendations. And then also we do have lots of pediatric practices will have meet and greets with pregnant moms. So you can definitely always call up and ask, can I meet one of the pediatricians? Can I talk through what the process is? There is some flexibility, as I mentioned, the first week or so about when they'll want to see your baby. So kind of getting that expectation, like, do I call the next day after I get out of the hospital? Like, do I call when I'm in the hospital? What's that like? And who do I call? Right. Because they, most times if you're going to see a doctor, right, it can take, 1 to 2 weeks or even a month to get in to see your own doctor sometimes. But especially for newborns, there's always appointments open that, practices will save appointment slots. So they know, can get one in then right after the baby is born. So it's usually a good way too.
Do you have some questions you suggest people ask? If you're doing a meet and greet, what are the best questions to ask to make sure that you're both a good fit for, both your lifestyle and the practice?
Yeah, I think a good thing to ask is, what kind of support does the practice have for you, right? So a lot of times, especially with newborns, if you're first time mom or second time mom or just a mom who forgot what having a baby was like, you may have questions that come up in the middle of the night, or you may have, things that you want to ask that, if the baby has a fever or something's going on, right? So always asking, do they have an after hours call service, or what's their same day appointment system like? And then asking also, do you have a lactation consultant? A lot of private practices, pediatrician offices will have a lactation consultant on site, or sometimes they have mental health support on site. So or people that they are really well established with that they say, oh, we always, just walk down the street and that's, where they are. So those are some good ideas, good questions to ask when you're doing your meet and greet.
And I guess for our last question, what do you find the number one question is when people come to you when they're having a baby or when they have a newborn?
Yeah, I think we touched about it a lot. Just, how do I know if they're getting enough, or how much should they be eating, right? And it's really just paying attention to those cues as much as possible. And, it's a learning process. I think in the beginning, nobody knows exactly how to be a mom in the beginning, especially to a newborn, right? And your baby's learning too. And I think it's a good idea just to remember that, and just to, when you're getting frustrated, take a deep breath, because it's a learning process for you and the baby to figure out. But the baby's cues and how they're communicating with you, and just making sure you're keeping track of that weight as much as possible.
Well, thank you so much for your time today, Dr. Lee. Make sure you give her a follow on Instagram at Steph Lee MD for more pediatrician tips. Thank you so much again for your time today. We really appreciate it.
Yes, thank you.